Here, we are chatting about healthcare lies that we are leaving in 2025. Healthcare lies that we are leaving in 2025. Myths, lies, things we've been telling ourselves, things that we've believed for so long when it comes to healthcare, our healthcare system, how access works, how things should look. We're going to chat about it today. I'm excited. We are in a new year. Let's get a refreshed mindset around our healthcare. Even with all that's going on in the economy and our country, there are solutions and we're here to talk about them. But first, we got to get our mindset together and talk about the healthcare lies we're leaving in 2025. Okay, welcome back. Those who are new here, I'm Dr. Jade. I'm a board-certified family medicine physician. I am the founder and medical director at NSPIRE Primary Care. This is my childhood dream come true to provide quality and affordable healthcare to my hometown and beyond, and to share about what our healthcare system looks like and how we can improve it and solutions that we can find within our healthcare system. And so here we are. We're in a new year. I hope that you all are refreshed and, excited about the new year. I'm excited to be refreshed and had a nice holiday break, and I'm excited to be back to chat with you guys. As you join, as always, drop in the chat, where are you joining from? I'm joining live from Las Vegas, from NSPIRE Primary Care, and drop any questions about healthcare you have, but we're gonna jump right into it, okay? All right, so it's a new year, new energy. Let's talk about the healthcare myths and lies that we are leaving in 2025. On social media where they're like, all the things I'm leaving in 2025, right? That is what we're doing with a healthcare focus, all right? Okay, so here we go. First of all, why does this matter, okay? Why does this even matter? Because if you've been, haven't been living under a rock, healthcare is changing fast, right? So we have the rising premiums, we have the higher deductibles, we have fewer doctors within these health insurance plans if you can afford them. We have the subsidies expiring or expired, right? And so we have all of these healthcare shifts, and we're talking about how to pivot. Properly, strategically pivot with the climate that we are in. And there are solutions. You already know, if you're in Las Vegas, NSPIRE would love to be your healthcare home. But let's chat about the healthcare myths and lies that we got to get rid of coming into this new year. You ready? All right, here we go. Healthcare lie number one is that health insurance equals healthcare. Health insurance equals healthcare is a lie we gotta leave in 2025, okay? It cannot enter 2026. We've got to understand, health insurance is a financial vehicle. It is meant to help us hopefully avoid bankruptcy if an emergency or a catastrophe in our health happens. What it is not access to your doctor. It is not access to quality healthcare when you need it. Healthcare and health insurance are two different things. And oftentimes in the culture of our country, we have just combined them into one thing. Healthcare equals health insurance. We gotta leave that lie into 2025. And if you're like, well, I don't have insurance, that does not mean you do not have healthcare. And the flip side of that, if you have insurance, that does not mean you have access to quality healthcare. So we've got to separate the two. And we've got to ask ourselves, if you have insurance, the question is, are you accessing quality healthcare with your insurance? Are you accessing a team that knows you well, that's easy to reach, that, when you call them, they know you by name and they know your history and they're able to get you help right away? If the answer to those questions are yes, great. Use your insurance for your healthcare. You have quality healthcare built into your insurance plan. Most of the time, the answer to that is no. If the answer is no, then we've got to get quality healthcare built into or added onto your health insurance plan, okay? If you're someone who's like, subsidies expired, I can't afford health insurance anymore, or if you're somebody who's a business owner or a contractor and you're cash pay, right? Just because you don't have insurance does not mean you cannot access quality healthcare, all right? There are healthcare models like NSPIRE that are formed and built for quality healthcare, not to be built around working for the insurance company. So we've got to separate the two in the new year, all right? Are we on the same page? Drop in the chat where you're joining from. And if you have any questions about healthcare, all right, we are talking about lies we are leaving in 2025 when it comes to healthcare. All right, healthcare lie number two that we are leaving in 2025. Primary care is expensive, okay? We are leaving that lie. We are leaving that lie in 2025. Y'all, I got the refreshed. I had a break over the holiday season energy. So just bear with me on the energy, okay? But the healthcare lie number 2 that we are leaving in 2025 is primary care is expensive. No, it's not. No, it's not. Okay. Primary care is affordable. And I know that all of that in one sentence doesn't make sense to most of our minds. But when you remove the upcharges, the hidden fees, the greed that insurance companies add to primary care, when you remove that and actually look at what primary care costs, it is very affordable, okay? And so that is what we do in Inspire Primary Care. We remove insurance from the primary care office, which is 90% of your healthcare needs. Only 10% of healthcare needs for most adults fall outside of the primary care office. So 90% of your healthcare needs is primary care. And that 90% of healthcare is actually affordable. It's the 10% of care, the emergencies, the surgeries, hospitalizations, if you need to see a specialist, right? That part of care is expensive, and we need a strategic, affordable, catastrophic plan customized to your needs for that 10%. But for the 90%, this is why we created the membership model of Inspire Primary Care to affordably cover that 90% of healthcare with your healthcare team that knows you at your fingertips, okay? So we're leaving the lie in 2025 that primary care is expensive. No, it is not. Labs, imaging, medications, we have wholesale rates on those without the insurance markups, and that is very inexpensive. It's very affordable. Let me give you some examples because I know you're like, well, what's affordable to you, Dr. Jade, right? No. All right, bear with me. So labs, for example, labs without insurance markups, we can order a full comprehensive lab work for you, right? For $58 cash. Those same costs would be $300 plus with insurance, all right? Or more expensive if you say that you're cash pay. But at a wholesale practice, a membership practice that gets the wholesale rates, and they do that directly with our type of practice style, which is called a direct primary care practice style, $58 for a full lab panel. That's it. No surprise bills, no confusion, all right? For example, if you're like, well, what if I just want thyroid? That's $10, okay? What if I need my hemoglobin A1C? $8. So we can break it down. It's all very inexpensive. Same thing for medications. Generic medications, which most medications have a generic, and those are less than $20, okay? Without insurance markups, which are sometimes more affordable than people using their copay for their insurance card, okay? Minus the thousands of premiums you're paying every month, okay? So we have to get our mind around this. If you do a mammogram through our practice during Breast Cancer Awareness Month, it's $99 for a mammogram. X-rays are $25. Walk in the same day and get it done. So I just need you guys to know, when we remove insurance greed from the primary care office for 90% of your healthcare needs, primary care is very affordable. So we're leaving line number 2 in 2025 that primary care is expensive. We're just not going to let that happen. We're not going to let that come out of our mouths this year, right? Okay, drop in the chat. Where y'all joining from? Y'all quiet on me in the new year, but that's okay. Healthcare lie number 3 that we are leaving in 2025. Y'all ready? Primary care is just for referrals. Honey, you're going to make me gag, okay? No, primary care is not meant for referrals. What happened was, once insurance and corporations took over healthcare and primary care, they basically said, where do we make the most money? We make the most money in specialist offices. We make the most money in surgeries. We make the most money in hospitals. So they basically turned primary care into a burn and churn conveyor belt system where you get them in, get them out as fast as possible, get them to refer to the places that they actually make more money. And then that is how primary care became culturally viewed as a place that's just meant for referrals. That is not how primary care physicians and providers are trained. We're actually trained to cover 90% of healthcare needs. What that means is when I did training in residency, I rotated with dermatologists to learn dermatology. I rotated with cardiologists to learn cardiology. I rotated with orthopedic surgeons to learn orthopedics. That is how family medicine doctors are trained, okay? That is because 90% of healthcare should be treated by primary care, and then those physicians know when it's supposed to be referred to a specialist, right? And so that is how we're trained. In this type of model at Inspire, we are able to practice to the top of our scope, meaning we're able to do in-office procedures. If you have that laceration, we can repair that cut in the office, right? With a laceration repair. We can sew that up. All right. We can, do all of those things in office. We don't have to just refer you right away because we're not rushed. But in insurance-based offices, the doctors are required to get people in and out within 5 to 8 minutes. And in that short time frame, the only thing you have enough time to do is refer, give a pill, or, send to the hospital. Those are like the 3 options you really have time for. That is why we remove all of that. And we have unrushed relationship-based care where it's like, okay, if you have acne, of course I'm not going to just send you to dermatology. There's so many things we can do to treat that in the primary care office, et cetera, et cetera, et cetera. I could go through all the chronic diseases with that, okay? So we are leaving the healthcare lie in 2025 that primary care is just for referrals anyway. Like, why would I pay for that? No, it's 90% of your healthcare needs, all right? Okay, we ready? We got 2 more. All right, healthcare lie number 4 that we are leaving in 2025 is that there is no quality healthcare in Las Vegas. Y'all, we are leaving that in 2025. We are leaving that in 2025. I don't want to hear the only way to get quality healthcare in Las Vegas is to go to McCarran Airport. No, we are leaving that in 2025, okay? NSPIRE is built to be your healthcare home. Now, I am from Vegas. I grew up here. And the reason my mission, as a child, I knew I wanted to be a doctor. At 4 years old, I started saying I wanted to be a doctor. But I started getting my healthcare growing up in Las Vegas. As a young adult, as a teen, as an undergrad, I was looking for quality healthcare in Vegas. I also had a very difficult time finding it, right? I did what most people did once I became a woman, a young woman, and used my OB-GYN and just said, oh, I guess that's my primary. Or I would just go to urgent care and be like, well, I guess that's where I go when I get sick. That is not how primary care is supposed to work. It's supposed to be a relationship with your healthcare team that knows you well, that can care for 90% of your needs easily when you need them, all right? And help you navigate the healthcare system if something falls outside of the primary care office. That is how it's supposed to be. So we're bringing that old school feel back to the new school, okay? But adding in technology where we can text, do Zoom, phone, video, all the things. But your team is just an easy text or email away or a phone call away, okay? So we are leaving the lie in 2025 that there's no quality healthcare in Vegas. Stop it. NSPIRE should be inserted, okay? NSPIRE is meant to be your healthcare home to solve this problem. Public Health _me says, love this. Thank you. Where are you joining from? Are you joining from Vegas? And thank you for being here. Okay, last one, y'all. Healthcare lie number 5 that we are leaving in 2025 is that healthcare is also expensive for businesses, meaning this one is talking to the employers. So if you're a business owner, or if you are an employer, or if you are on the leadership team, COO, or an HR manager, etc., and if you are saying to yourself, healthcare is expensive for businesses, we are leaving that lie in 2025. Here is what smart businesses, groups, and organizations are doing. They are partnering with NSPIRE, all right? They are partnering with NSPIRE for their healthcare. And we are combining NSPIRE with a low-cost catastrophic option. And we are customizing that to the needs of businesses. We work with small and medium businesses throughout the Las Vegas Valley. We care for teams. We are blessed to care for so many businesses and employees throughout the Las Vegas Valley. And if you are a Las Vegas business owner or organization leader, sorority leader, etc., and you're like, man, I really want quality healthcare for our business and I want it to be affordable, or our organization, you got to reach out to NSPIRE, because we are lowering the healthcare cost for businesses and organizations while improving the quality of care. And it has been an absolute joy and pleasure to see the second highest line on most businesses' P&L is the healthcare insurance expense. So we are bringing that down while increasing the quality of care, which is just a dream come true. So if you're an employer or a decision maker at a business, or you know a decision maker at a business, tag them, share this, let them know, because most people do access health insurance and healthcare benefits through their employer. So, we have a solution. We have a solution where it doesn't have to be so expensive. All right, so let's summarize it up. These are the things we're leaving in 2025 when it comes to the healthcare lies. All right. Healthcare lie number 1 is insurance equals healthcare. Okay. Healthcare lie number 2 is that primary care is expensive. No, it's not. Healthcare lie number 3 is that primary care is just for referrals. It's 90% of your healthcare needs, and it's your healthcare home. All right. Healthcare lie number 4 is quality healthcare does not exist in Las Vegas. Stop it. It's NSPIRE. That's your healthcare home. And then healthcare lie number 5 is that healthcare must be expensive for businesses too. Nope. It's called NSPIRE Corporate. It is very affordable and flexible for businesses. Okay, are you ready? So here's the equation. If you can just take away one thing from this live today, I want you to just think about the new equation to think about in 2026 when it comes to healthcare. And that is 90% of primary care. 90% of healthcare is primary care. So that's 90, all right? Plus 10% falls outside of the primary care office, which is your catastrophic coverage, all right? And the catastrophic coverage 10% does not have to be a traditional PPO HMO plan. If those work well for you, great. If the price point works well, the access works well, great. Keep that 10%. But if it's expensive, it's burdensome, it's a hassle, I can't reach people when I need them, then we need to reevaluate that 10% and get that customized to your needs. And there's all sorts of options for that. There's indemnity plans, there's supplemental plans, there's health shares, there's high deductible health plans paired with the HSA. Like there's all kinds of things, and we help our members navigate what's the customized 10% catastrophic coverage that's best for them and their budget, while pairing that with a high quality 90%, which is NSPIRE Primary Care. All right, we got it. So 90 plus 10 equals the 100. 90 is the primary care, 10 is the catastrophic coverage. Okay, we are leaving in 2025 that the 90% to 100% equals health insurance, and that equals health care. And I just have to take what I'm given by, the government. Like, no, we're leaving it in 2025. Our eyes are opened. We're walking into 2026 boldly, confidently, knowing that we have options, knowing that there are solutions. All right. And if you're in Las Vegas and you're like, man, I didn't even know, I want to do this, NSPIRE would love to be your healthcare home, your whole healthcare team at your fingertips, an easy text and email away, relationship-based care, affordable quality primary care. We have multiple tiers to fit every lifestyle. So if you're just virtual, we have NSPIRE Virtual if you just need virtual care. We have the full concierge experience, NSPIRE Concierge if you want in-office and procedures and care coordination. We have NSPIRE Specialty, which includes medical weight loss and hormone management. And we have NSPIRE Longevity that is launching, that will include longevity labs and peptide supplement plans. And we also have NSPIRE Corporate for businesses, okay? Las Vegas businesses. So tag, share with your friends. Be a friend that is a friend in 2026. If you know someone who you're like, any of this would fit so-and-so, and so-and-so could use this, or so-and-so's business could use this, tag and share this live with them, okay? I have a special offer for you, okay? Each time I come on live, I'm gonna try to have a special offer for those who stay till the end, okay? If you text us today the word live, okay? If you text us the word live today and you enroll today, we will waive your enrollment fee, all right? So we're gonna save you some money. If you text us the word live, that will let me know that you watched the live today, all the way to the end. And if you enroll today only, what is today? Today is like the 5th, 6th, I can't even remember, January, all right? If you enroll today and text us the word live, we are waiving your enrollment fee just for being a part of the social media fam, okay? I think that's it, you guys. Let me look and scan the comments. Okay, Public Health _ME says, joining from the East Coast. Where are you joining from? And I ask where because, one, I'm nosy and I want to know. But two, we're considering, you guys have been asking us for the longest, like, will we expand our services virtually to other states? And we're considering it this year. So if you're joining from the East Coast, Public Health, let me know where you're joining from. And, if you guys are watching from other states and you're like, I would love to be a part of the NSPIRE fam and I live in this state or that state, let us know, because we're accumulating some, different states to consider adding so that we can expand virtually. And Public Health _me says, Washington, D.C., do it, please. Okay, so we're going to add D.C. to the list. I'm really excited. So we're going to start curating a list for virtual in other states. So you guys request it. Let me know what states, because we only want to add states that are already a part of our fam, that are already ready and excited to be a part of the NSPIRE family, okay? Carrie says, do you refer to home health or hospice? We sure do. All right, absolutely. We coordinate your healthcare needs that need to be coordinated outside of our office. We absolutely coordinate those. And the beautiful thing is, if you have an insurance plan, we can help coordinate those, and you can use your insurance plan for the things that fall outside of our office, okay? That 10% catastrophic coverage, if you have catastrophic coverage for those things, you can use your insurance for those things outside of our office. The 90% of healthcare needs where we're a text, email away, you have your same team, that is covered under your NSPIRE membership, whichever membership tier works best for you and your family. So we make it really easy, affordable. I think people, when this originally, kind of came out, we're about to turn 4 years old, you guys. Like, NSPIRE is becoming 4 years old next month, February 1st. I'm like, wow, where has 4 years gone? But 4 years ago, when we opened, people thought I was crazy. And they were like, is this a scam? Like, what is this membership for healthcare? But you guys, we got memberships for everything now. And we figured out a way to make healthcare affordable, accessible, remove the insurance greed, make healthcare what it's supposed to be, a relationship with your team that knows you and giving you the care you need when you need it. Like, that should not be hard, right? And we figured out a way to do that, which is the membership model of healthcare called direct primary care, also sometimes called concierge style care. Long story short, it's a membership for your primary care, which is your 90% of healthcare needs. And then we're customizing an affordable 10% for the catastrophic coverage that falls outside the primary care office. It's simple, y'all. The days of just saying, I got the PPO, HMO, and I'm good, those days are gone. And those who are still holding on tight to that old mindset are going to suffer even more with the changes that have come in our, system and in our politics and all the things, okay? We've got to evolve, right? We're no longer really taking taxis. We're doing Uber, right? We're using Amazon. We're not just going to stores for everything. We're not going to Blockbuster. We're using Netflix. So everything is evolving. Those who are stuck behind in the old days are going to suffer. And we don't have time for our healthcare to suffer in 2025. All right. Or 2026. We're leaving that in 2025. All right, y'all. Thank you for joining us. All right. If you watch the replay, text me or DM me, leave a comment. I'll look back and see if there's any comments, any other questions. Drop those below. I'll come back. I'm going to try to do weekly lives, okay? In 2026, I'm going to try to do them weekly, but I am committed to at the end of each live, I will give you all an offer to remove some money, from the barrier to joining NSPIRE. So we'd love to be a part of your healthcare home. And if you have any questions, drop them below, and I'll see you guys on the next live. Happy New Year, okay? I didn't get to tell y'all happy holidays, I don't think, but hope you had a Merry Christmas, and I hope you are having a wonderful New Year. And if you're not, I hope this brightens your day a little bit. All right, I look forward to caring for you, and our team would love to care for you. You can text us live, okay, the word live, at 702-867-0017 if you just want information and you're like, okay, I'm not ready to enroll today, but I would like more info. Text us the word info to 702-867-0017. We look forward to caring for you in the new year. Bye.